Hello, and welcome to this overview of genetic testing for inherited retinal disease patients. Over the next few minutes, I'm going to talk about the benefits of genetic testing for IRD patients, as well as provide an overview of the Foundation Fighting Blindness's own no-cost genetic testing program. I'm Ben Shaberman, Senior Director of Scientific Outreach at the Foundation Fighting Blindness. And along with my colleague Michelle Glaze, we provide outreach to eye care professionals to educate them about the many resources like genetic testing that are available for inherited retinal disease patients that doctors can provide for their patients. In case you didn't know, the Foundation Fighting Blindness is the largest private funding source of research for retinal degenerative diseases. So to start off, I just wanted to provide some basic facts about inherited retinal diseases to set the stage for the discussion of genetic testing. Inherited retinal diseases include conditions like retinitis pigmentosa, Stargardt disease, Usher syndrome, and Leber congenital amaurosis. There are many others. Those are some of the more common of these relatively rare conditions. And collectively, all these conditions together affect about 200,000 people in the US. So even collectively, they are considered rare. Now, just about all inherited retinal diseases are what we call monogenic. That is, for each patient, there's one mutated gene causing their disease. But when you look at the collection of inherited retinal diseases, there are somewhere in the neighborhood of 300 genes, each of which, when mutated, could be the culprit. So these conditions are very genetically diverse. But if you can identify that mutated gene for each patient, then you can really get them on a path forward for managing their condition. And with somewhere in the neighborhood of 40 clinical trials underway for emerging therapies in this space, genetic testing, identifying that mutated gene can really help people qualify for these trials because many of these studies require a genetic diagnosis. So there are other reasons why genetic testing can help a retinal disease patient, an inherited retinal disease patient. First, it can confirm or change the clinical diagnosis. Even the best experts in inherited retinal diseases may not always be sure what a clinical diagnosis is, or there could be a misdiagnosis. A lot of these conditions look alike, and again, sometimes it's hard to really tell exactly what's happening. But if you can identify the mutated gene causing the retinal disease, then you can get a much clearer diagnosis. And our genetic counseling partner, Informed DNA, I'll be talking about their genetic counseling services in a few slides. They did a study that showed the clinical diagnoses for IRD patients changed in about 13% of cases after genetic testing. So once you can identify that mutated gene causing a person's inherited retinal disease, then you can confirm the inheritance pattern and what the risk might be for other family members to inherit the condition, whether it's children, siblings, or other members of the family. And again, excitingly, there are somewhere in the neighborhood of 40 clinical trials underway for emerging therapies, and many or most of these really require a genetic diagnosis. And for those patients who happen to have a mutation or mutations in the gene RPE65, there is an FDA-approved gene therapy called Luxturna, which has provided some dramatic results, some dramatic vision improvements for children and young adults with mutations in this gene. So that is now available, and that can be a life-changing therapy for, again, these people with RPE65 mutations. Now, there are many programs available for genetic testing. I would like to highlight the Foundation's no-cost genetic testing program. This is really a partnership between Blueprint Genetics, which provides the actual genetic testing, the panel. Informed DNA, which is a really outstanding genetic counseling organization. And then the third element of this partnership is the patient registry, the My Retina Tracker registry provided by the Foundation Fighting Blindness. And an important point about the Foundation's no-cost genetic testing program, of course it is no cost, that's a key benefit, but it's more than just a testing panel. It's more than just getting a genetic testing result. It's really about helping patients and families understand their conditions, manage their conditions, and get them on a path to potentially getting into a trial or a future therapy. Now, in addition to helping patients and families, by genetically characterizing more patients and getting them into our registry, we have more candidates available for companies and researchers that are conducting clinical trials for emerging therapies. Because these conditions are rare, clinical trial recruitment can be a little challenging. So again, by genetically characterizing more patients, getting them into our registry, we can make them available for these trials. And a last point about our genetic testing program is that we always protect the patient's privacy. Whether it's through the testing, the counseling, or the registry, we never share personal information with third parties. So let's talk a little bit about Blueprint's genetic testing panel. It is open to all patients in the U.S. who have been clinically diagnosed with an IRD. The exception is if someone has gotten tested with a large panel within the last 4 years, we ask that they wait for that 4-year period to end before they get retested. But really, just about any ophthalmologist, retinal specialist, or optometrist can order the test, any that are in the United States. And since the inception of this program back in 2017, we've had somewhere in the neighborhood of 10,000 people that have had a test ordered. So this program is relatively mature, the processes are working well, and we're pleased with the success. An important point is the doctor orders the genetic test directly through Blueprint. They do this online, and I will be providing more information on that on the next slide. You don't go to the Foundation Fighting Blindness to order the test. The patient doesn't order the test. The doctor orders it online through Blueprint. The test is normally a buccal swab, a cheek swab, or a saliva sample. And once that sample is sent out, it takes about 4 weeks for the results to come back to the doctor and the genetic counselor. And currently, we do get a conclusive results. That is, the mutated gene is found in about 60 to 70% of cases. Now, the Blueprint panel is very broad and very deep. It has 351 genes at the moment, and it can also identify some hard-to-find mutations through screening of intronic areas of the genome, and it can also identify many copy number variants. So this is how physicians order the test. You go to Blueprint Genetics and you go to the Nucleus portal. That's nucleus.blueprintgenetics.com, the login screen, and make sure if you're a physician, you order the My Retina Tracker panel. There are many different panels that one can order, but if you want to get the no-cost panel through our program, it's the My Retina Tracker panel. And make sure when you're going through the ordering process that you order genetic counseling. So a vast majority of doctors who use our program do order informed DNA genetic counseling. If you happen to be with a clinic or a practice that has your own genetic counselor, you're free to use your own genetic counseling. But either way, genetic counseling has to be provided through this program. And so speaking of genetic counseling, I've already mentioned that informed DNA is a really outstanding genetic counseling provider. And really the bottom line with genetic counseling is it can help patients and families understand the results of the genetic test. These results can be rather cryptic in many cases, and then the counselor can really help provide the patient and the family a path forward for managing their condition. Informed DNA is everywhere in the U.S. They provide services throughout the U.S. Over the last 3 years, they've counseled more than 3,000 patients with inherited retinal diseases. They are really experts in this space. And as I said earlier, a vast majority of doctors that use our program do use informed DNA genetic counseling, about 90%. The counselors, generally speaking, are very experienced in the IRD space. They have an average of 7 years of genetic counseling experience. Now, the services are provided over the telephone, so the patient and the family don't have to go anywhere. Informed DNA is flexible about the hours, so the appointment can be made over the weekend or during evenings. Sessions are anywhere from 60 to 75 minutes. It can be the patient and family members, whatever makes sense for the patient. And again, genetic counseling is required. And then finally, I wanted to briefly review our My Retina Tracker patient registry. And really the biggest advantage or the biggest benefit of the My Retina Tracker registry is it can help patients get on the radar screen of clinical trial recruiters. And it's the patient who creates and manages the record. Sometimes informed DNA genetic counselors will help patients get the record started, but it's really the patients who manage the record, or perhaps a family member. This is a global registry. It's no cost, it's very secure, and it's relatively easy to use. A lot of the information is entered through pull-down menus, and it's been designed to be user-friendly for people with low vision or those who have lost all of their vision and use screen readers. This registry has been around since about 2015. We have more than 20,000 registrants, and it's available at myretinatracker.org. Again, that's myretinatracker.org. As I mentioned earlier, privacy is always protected for patients in our program. That includes patients when they're in the registry. We only share de-identified data. If a company is doing a search in the registry for, let's say, potential clinical trial participants, they never get the patient's names or personal information. The search results are actually forwarded to us at the foundation, to our administrators. Then we reach out to the patients and families. We let them know that they matched the criteria of a particular clinical trial. Then it's up to the patient or the family to contact the clinical trial recruiter. And an important point here is to be in the registry, a person does not have to have had genetic testing. They don't have to know their gene. And likewise, you don't have to be in the registry to get genetic testing. So that concludes a brief overview of genetic testing for IRD patients and the Foundation Fighting Blindness program. Appreciate your time. If you have questions, I encourage you to reach out to my colleague, Michelle Glaze. She can be reached at mglaze@fightingblindness.org. That's mglaze@fightingblindness.org. As part of our department, we provide a number of resources for eye care professionals to enable them to help their patients manage their IRDs and get on a path forward. So if you want to learn more about some of these other resources, I encourage you to reach out to Michelle for that. Thank you.